hopefully Kath will join us any second now. As I explained to those that were here, there's a Wi-Fi problem in the trust that she works in, so we are just struggling to get Kath just online with us at the minute. So we'll get going and we may come back to that first slide. So this is BAA board at conference last year. So you can see that actually we're a very small group of people. We're all, apart from the president, completely voluntary at this. We all have day jobs, and at times those day jobs can be quite stressful. We try and flex as much as we can. If we know somebody has a particularly difficult point, you know, your IQIPS submissions, those kind of things, then obviously we try and pick those up a little bit more. I can see that Kath has joined us just in time to talk about herself. So I'd like to introduce you to Kath. She's our new president, and I just wanted her to say a few words about her.
Just about me. Hi, everybody. Oh, is this
There
a run through, Sue? Yeah, I'm
no,
here.
we're,
Yeah,
we're live and away.
Right, just a second. Okay, so hello, I'm your new president. Earlier than anticipated, but very proud to be your president, and I hope I do a good job for everybody here. And I have to say that I can't do this job without the backing of the board, and especially Sue, who's been absolutely fantastic in supporting me through these past few weeks. So there you go. I've been in audiology for a long time, so I'm one of the oldies now, and I love this job. I've been a part of teaching and part of developing services, so you know, this is just what I'm at. It's very hard to see if I'd ever give it up at all. Okay, so next slide. So looking at our members, and you know, we've been doing some amazing things throughout audiology. You know, we've really stepped up to the mark because it's been a really challenging time. Our members have been involved in lots of different things and have been redeployed in lots of different areas. So this has been an opportunity to have a wider look at what happens in the NHS and given us some new things to develop in ourselves. So hopefully that we can take back into our services as we are now beginning to do that as we restart. So, you know, people have been working in the Nightingale Hospital, they've been doing swabbing, they've been involved in some of the management side of things. It's been absolutely amazing. So well done to everybody out there who's got involved and stepped up to the mark. So, yeah, you're all amazing people. Okay, so what happened when COVID hit? Of course, that we had to shut down services for a little while. Of course, many of us were still seeing some people as in the best way that we could. We had to rethink our heads of service meeting, which we had scheduled for the 26th of March, which was a get-together. So we had to postpone that. So what happened from that is we decided to have some twice monthly heads of service web meetings, which were there to actually help each other and share some of the things that we've been doing and work on some guidance to help us to get through this situation. So from that, of course, we've been looking at our joint guidance work, which I hope some of you have seen. This is all on our website. We've looked at remote working guidance as well, and that's been from the SQC and MANCAD, which we'll talk about later. Also the newborn hearing screening programme as well. And we've had lots of good feedback from people who've been redeployed and what's been happening there. And then, of course, the students who had to suspend their placements with us, which was quite sad, really. So hopefully there's something that we can help them with, which we'll talk about in a little while as well. And then we looked at staff wellbeing because, of course, this was quite an upheaval for most of us, and everybody's coped in different ways. And it's been okay to feel really anxious at times. We recognise that, so we've been looking at things that could help out, and we'll talk about that again later on. And then we've got some ideas for CPD, which of course this is an ideal opportunity to get our CPD ideas up to date, and get involved in doing some online learning. And I'm sure we're all doing a lot of online learning at the moment. And then as things started to settle a little bit, we need to look at recovery plans, because that's really important. It's going to be really difficult going back to anything like we've had before. So we really need to think about how we do that. So we've had some good ideas that have been shared with us, and we can talk about that too. And then, of course, face masks, and Sue's been really heavily involved in this, and this is her baby, so we're definitely going to talk about face masks as well. So these are all the things that we've done on the Heads of Service meeting, and we thought it'd be great to actually share it with the wider membership as well, so you know what we've been actually doing. So can I go to the next one, please? And then I'm handing over to Sue now.
Yeah. So, hi everybody, and I got to be impressed by the timing of Kath arriving. Our joint guidance has been a piece of work that I've been heavily involved in, and we chose to do this with other organisations across audiology. We'd released a BAA guidance quite quickly after lockdown started, because one of the things we felt was important was that people were able to at least put some guidance in front of their managers that said we need to keep a postal service, because there were some worries that our existing patients wouldn't be looked after at the very start of this, and that everybody would be redeployed. So our very first BAA guidance was quickly superseded by the joint guidance. The joint guidance has actually been reviewed 3 times. And I'm going to outright give credit to all of the agencies involved. So BSA, BSHA, AHIP and ourselves have all been heavily involved in pulling this guidance together. It actually now includes provision for the lockdowns. So actually on the day that we were finalising the last joint guidance, Leicester unfortunately had to remain in much more severe restrictions than other parts of the country. And of course over the last couple of days we've had Dumfries and Galloway under a more strict lockdown as well. So we've tried to update to give us a little bit of guidance if something like that happens again. Guidance on fabrics is in there, because of course we have this weird world of fabric in audiology that's so important to our acoustics, but has given many trusts nightmares and many infection prevention nurses some quite severe sleep issues, I think. We've had some conversations around air conditioning, and we have some guidance in the new version on that. We have a vestibular guidance that was put together by the BSA SIG, and we have a small amount of paediatric guidance that came from the British Association of Otolaryngology for Pediatrics. So let me just walk you through some of the main changes. One of the things we did was to highlight everything in purple. So everything we changed in the latest guidance is in purple text. So if you've read the original guidance, it should be quite easy to find the stuff that has changed in this version and that we've added in, so that you can quickly find the bits we've added in and see how they relate to what you've done. All the way through, the most important thing has been as much evidence as we can get to ensure that our clinicians and our patients are kept really safe. So all the way through, we have tried very hard to evidence what we've done. We've had to be pragmatic about some things, but there are some good pieces of evidence in there. So if you have to put a plan together in your department, don't just read the text, but also look at some of the links and things in there to get your evidence for some of the decisions that you're going to have to make on a local level as well. So we put in a return to routine appointments because the government changed the alert level during June, and it reduced it down. So we did put in a return to routine appointments into this particular guidance. We've changed so that face-to-face appointments are offered as to all patients as required. So in the previous guidance, there was something about not doing screening. So if people didn't actually report a hearing problem and we were just doing it as part of a sort of screening program, then we were saying that that probably shouldn't be done face to face at the moment. But of course, we still need to do those really strict triaging for COVID symptoms, and that means that digital first approach where we either contact them by phone or by video call prior to an appointment allows us to screen not just for COVID symptoms, but also to triage the type of support required. And we think that's going to continue even when you're allowed to start seeing your routine patients in each trust. We do believe that there is going to be a need to reduce the amount of footfall in departments, and obviously some departments are talking about 1/3 of their throughput and some are talking about 2/3, and that's going to be a very local decision there. But what we wanted to do was say that everybody should have some contact before, so that we can screen out for COVID symptoms, but also we can screen for the type of appointment that they're going to be suitable for and have those conversations about the different types of care we can now offer, and the sort of type of support that they do need in order to help us to reduce our actual face-to-face numbers for the time being. We changed the physical distancing advice, so following your government's advice is what we have, because of course across the 4 nations now we have slightly different decisions on physical distancing. I know this has been really difficult for some departments with very small rooms, and there've been a lot of concerns, but there've also been a lot of things done in terms of perspex screening between yourselves and the customers if you can't get 2 metres away. In NHS England hospitals, of course, we're still on that 2 metre distance or you need PPE, and that isn't changing in the healthcare sector at the moment. So it is important that we put something in that almost future-proofs this, that it is about the government's advice on physical distancing. There are no time limits on how long you can see a patient for. So people were concerned initially that if you were in a room with a patient for a long time, you were more likely to be exposed. But actually, we don't have evidence of that in non-symptomatic patients. We do have evidence of non-symptomatic spread, but that's what the guidance was written for. The guidance was written with the assumption that everybody has COVID, both you and the patient. And I think that's really important. The reason the guidance says 2 masks, it says 1 for you and 1 for the patient, was because of the high levels of community transmission when the guidance was originally written. So we did say we didn't want to specify procedures because we felt that that could be too restricting for somebody doing an unusual role within audiology. But we did want to say that if you're within 2 metres of a patient, you should be wearing your PPE. But what we were talking about when we were grouping procedures was because we're not experienced PPE wearers, and we didn't want people to be wearing PPE for too long. So although we understand that masks are sessional and quite a lot of trusts are asking people to wear them as sessional things, so you're not allowed to touch them in between patients, there are runners to make sure that you can keep your masks on and you don't have to go in other areas. All of those things I know are in place in some departments. We did feel it was important to give you some guidance that said our population is quite unique in that we'll be coming across more people with hearing loss than an average department in a hospital, and we wanted to be able to say that you could take your PPE off at 2 metres and you could have an appointment that was socially distanced, but was allowing communication. So by grouping your routine parts of touching, you could take off your PPE and move back, is the thought behind that, and the guidance behind that came from there. It wasn't about limiting what you do in close contact. It was about limiting how many times you have the, I'm going to say option, you have the need to touch your PPE, I guess. Oh, don't we get very confused about this one? Aerosol generating procedures was the biggest reason we switched services off, because we couldn't find any evidence about the cough reflex when we first started the guidance. We actually had a point where we said that we shouldn't be looking in the ears, we shouldn't be doing anything that could generate a cough, and we needed to find evidence that came back and changed that guidance. And we did, and we asked specifically the Infection Prevention Society, and you can find that in the appendix at the back of the guidance. So in April, we asked them quite specifically about what happens if we cough during a procedure, if the patient coughs during a procedure. But the other thing we found later, and this was only released in June, was that coughing was actually included in an AGP document that was worked up by National Services Scotland but is adopted across the 4 nations, and it does talk about coughing and the fact that it's not an AGP, but it does create aerosols, but so does talking and breathing. So the idea of the mask for you is to alleviate the issues of somebody coughing. I will debate with anybody the argument around surgical masks and the cough coming out the sides. That's not how physics works, and I'm sure a lot of you understand the fluid dynamics. If you cough forwards and into the mask. We aren't looking at coughs escaping down the side of masks. So we do think we do have some potential aerosol generating procedures in audiology, and we've tried to make it very clear in the guidance that the 2 things we consider could be, or 3 things we consider could be aerosol generating, are tympanometry, air chlorics and wax removal, where we've got an open, wet, perforated ear, and only where we've got an open, wet, perforated ear. We don't think you need to run screaming from the room if you discover a wet perforation on otoscopy, or if you're doing a wax removal procedure. We just would like you to stop the wax removal procedure. If it's just otoscopy, you're not moving anything, therefore you're not generating an aerosol. However, we did have a question about tympanometry, and we do still think that although there is no evidence that the middle ear mucosa being disturbed would create an AGP, there is a reasonable concern from ENT and otology that it may. So at the moment, the only restriction we have on practice is around wet perforations, and it's about wax removal, tympanometry and air chlorics. It's not about just looking in the ear, and it's not about things like real ear measurement, although those would not necessarily be great things to do on a wet tympanic membrane anywhere. One thing that came in quite late was guidance from the Health and Safety Executive, and it talked about air conditioning and definitely says that you can continue to use your air conditioning as normal, that you need to adjust your air conditioning systems if you can to get more fresh air and less returned air into a room if it's possible. But the risk of transmission through using ceiling and desk fans is extremely low, and the air conditioning can be used as normal. So again, that guidance is in there and it's linked in that document as well. And then, as I said, we added in the table. So this is the alert level table that's in the guidance, and it's just in there so that if you do move to a local lockdown, you still have guidance on what we feel you can and can't do and what is safe in those different environments. And it's just to make sure we can maintain some sort of service. So the other type of support that's been offered has been a lot of advice and guidance from our third sector, and hopefully we've got Crystal on the line still. Can we find her and turn her mic on? Any sign, Vic?
Hi there, can you hear me?
I can, Crystal. So I've just got your, if you want to introduce yourself and tell everybody why we've asked you to join us.
Hi there, thanks for having me today. So my name's Crystal Rolfe. I'm the Director of England Action on Hearing Loss. My background's an audiologist, and I'm a current BAA member as well. So thanks for giving me a couple of minutes today just to kind of let you know how Action on Hearing Loss can support you at the moment. So just wanted to tell you what we're doing during COVID-19. So we've got loads and loads of information on our website at the moment, very specific to coronavirus. In there, it kind of outlines all the different things people might want. And you can kind of signpost all of your service users over to that information. We've still got all of the usual things, the information and resources in accessible format. So you can kind of get hold of all of that on the website as well. Sometimes, obviously, you might be talking to people and they just might want that extra reassurance. And you know, sometimes people like to chat a long time, so there's kind of some extra things you can signpost people to. We've also updated all of our communication tips. So we've got, but in the light of the fact that people are wearing masks and people are having appointments, you know, a lot over the phone. So we've got communication tips for people with hearing loss, for their friends and family, and we've also created communication tips for health and social care professionals, and that might be something that you might want to signpost other colleagues in the hospital to as well. We're doing lots and lots of signposting to other organisations. So it's not just us as a charity that's supporting deaf and hard of hearing people. There's lots of other fantastic charities that support people with deafness, hearing loss and tinnitus. And so people come to us in an area that's not our expertise, we will signpost over to them. We've also found that a lot of deaf people are coming to us with issues at the moment that aren't necessarily directly related to the hearing loss. So, for example, issues if they're unable to get out the house, accessing food or medicine. And so we've been signposting over to lots and lots of organisations in their local area that can support them. And we've also been supporting those organisations to be more deaf aware. We've had lots and lots of things going on at the moment in our policy and campaigns team. I know that my colleagues there have been working really closely with the BAA on things like masks and people being able to access the information about COVID with an accessible interpreter. So there's been lots of conversations around that. In areas where we specifically offer services ourselves, we've paused all the face-to-face work, just like yourselves, but remotely we've been providing troubleshooting, support with videos that are out there, getting batteries to people, and we've been providing lots and lots of telephone befriending. So I think that's one of the really important things we can do at the moment, is that we can spend time talking to people over the phone, not necessarily about their hearing loss, about anything that they've got going on, but in a way that we know they can access through communication. And if we just go to the next slide, it's just the last one. Just wanted to signpost you to our national helpline. So just wanted to highlight that all of you can refer people onto our information line. People can access that via live chat, email, call and text message. We've also at the moment got for the first time, our information service is actually accessible via BSL as well. And we've also got a tinnitus helpline as well. So if you're talking to your patients and they just need kind of extra information, or they just want someone to talk to for a bit longer, please do signpost them onto that. and do contact the helpline, and they can put you through to the right person at Action on Hearing Loss if you've got any other questions about what we do or how we can support your department. We're here, we want to help. Sometimes that's us that can help, or sometimes we'll refer you on to a different voluntary sector organisation. So thanks for having me today, and well done to all of you as well. You're doing a great job.
Crystal, just a quick question from somebody on the chat was about accessibility in other languages of information leaflets and website information.
Yeah, we do have information available in a range of languages from a lottery funded project we had last year. So the kind of top 10 languages spoken in the UK. So if you can't find those on the website, if you contact the information line, they'll be able to signpost you through to them.
Okay, brilliant. Thank you very much for coming. And as I say, great just to have some up-to-date information that people can use as well. So yeah. Okay, thank you. We'll carry on. So I'm not sure how Sam's doing. I know she's had to swap to mobile.
I'm here. Can you hear me?
Yeah, just about. We might have to turn ourselves up for Sam because it's awkward.
Or I could always do that shouty thing that you do at webinars. So, can you hear me?
I'm trying to phone them.
So we just wanted to talk about the work that had been done on the remote guidance, really, and highlight what was on the website. The BAA,
I'm on this telephone assessment, yeah.
The BAA Service Quality Committee had been talking about best practice guidance for remote care for quite a long time, and this was to keep us up to date and competitive and ensure really that NHS services were looking to the future.
I get clinics set up, and I'm sort of going to try and do it.
Was accelerated by the pandemic, and service jointly with the Manchester Centre for Audiology Deafness to produce guidance for remote working in audiology. So the aim is really to give to support and CPD as well for people who have to look at remote options. The guidance, as you probably know, consists of 6 documents. One has the background and the evidence about the efficacy of remote care, and the other documents are more practical guidance for different areas of audiology, for example, adult hearing aids, pediatric, vestibular. And there's also a checklist to prepare for video appointments. I'd recommend that in particular everybody really got familiar with this, because as Sue said earlier, contacting patients even before face-to-face, even when we're more back to normal, remote care for triage and support is likely going to continue long after the pandemic. So if we just look at the next slide. Thank you. So on the website, there's the documents, and there's also lots of sort of more practical documents that services around the country have sent that you can download, and also recordings of the webinars we've done. All this is available on the BAA website for free. But we're also working on updates to the documents. So in particular, we're working on adult hearing aid and pediatric audiology further guidance. And this hopefully to guide services to prioritise which patients they're bringing face to face, and to really standardise and promote high quality in remote services that people are providing. Because all this is relatively new, it's really important that everybody shares their knowledge. So if you out there have got good examples of how remote services have worked for you, or anything really, we'd really appreciate it if you'd share with us. So mostly I'd like to thank Anne-Marie Dickinson, who's chair of the Service Quality Committee, and Gabby Saunders from Manchester University for leading really such an in-depth piece of work and producing it in such a short time. But a lot of other audiology professionals also contributed, so much thanks to them. And I think that's all I really wanted to say at the moment, Sue, if that's okay. Silence.
Hi, Sue, are you there? Has she gone?
I think we've lost Sue.
Sorry, turning
There.
you up turned me down and off. Am I back?
Yes.
Okay, excellent. So just to say that normally Jason would present this. He's been leading quite a small working group with the NHS England and sorry, Public Health England and NHS England as well. And I've put the names of that working group up because I think you should know that they have been doing a lot of work behind the scenes on this. We raised a concern with Public Health England very early on in the pandemic response, and Public Health England responded very rapidly by setting up a working group with our clinicians across BSA and BAA. And the documents were written, they were agreed, and they were published by Public Health England and NHS England. They've not always gone through a final read from the clinicians, but actually in the end have been great documents that have been got out in, I guess, crisis management. You have never seen Public Health England have to work like this before, and all credit to their staff for really keeping going with this project to make sure that guidance was good and it was readily available and it was timely. It is difficult for Public Health England to get a balance of things across the country that will work across the country, because of course some people have got services in different parts of the organisations that they work in. Some of them aren't attached to audiology, some of them are. So it has been a difficult balance, and the working group have tried to put out guidance with Public Health England that makes sense. They're interested, obviously, with the screening programme in the identification of babies with hearing loss. So they're not interested in the longer term protocols. And that makes it quite difficult because as we're getting on the chat box, every department is different and every department is getting different agreements for going ahead and stopping and everything else. So I'm not saying that as a negative thing about Public Health England. I'm saying that there are going to have to be some local things in terms of how you get babies followed up who may not necessarily have been screened. The team has guided people through this process during the pandemic. The relationships with Public Health England are now established going forwards, and we will have a clinical group between BAA and BSA and Public Health England that will help to formulate some of this stuff as we go forwards. So really it was credit to the team to say that all those documents are on the website and to say that the updates have been coming out regularly to heads of service as well as screening services. I want to say this for myself, which is just to say thank you to everybody that has worked on guidance, that's presented and shared their own protocols and their own procedures from within departments, that have just given of all of their work and their hard work that they've been doing to other members and to sharing to everybody in the audiology profession. We've tried not to keep anything behind our member-only firewall that would be useful to the wider profession, but obviously we still want to give you member value and we still want to take credit for the work that our members are doing, and to sort of say these are our members that are really stepping up for other members. So thank you for every member that's been involved. It's not just board, it's been a huge team effort to get this guidance out as well. Some of the work, what we were trying to do with this webinar is just cover some of the things that have happened in the Heads of Service webinar, and some of the work around redeployment was interesting right at the start. And Nightingale Sites developed a skill set. They developed all of the information around deployment for the Healthcare Science Network, and all of this is on the BAA website. But some of the things that members have been doing, Kath talked about earlier, we've had people in morgues, we've had people in pharmacy, we've had people in that have learned to take blood. Susanna tells me it's quite easy. I'm not very good at having my blood taken, but she promises me it doesn't hurt. And I think that's just the taking of the blood, folks. We've had people using their facilitation communication skills. We've had people checking equipment that's been purchased. All of these things have been where audiologists have been redeployed. So I'm now handing over to Lizanne, I think.
Hi, Sue. Can you hear me?
I can. I'm going away.
Okay. Come back, please. Right, so I'm just updating what Kath, or just continuing on from what Kath said earlier. With placements being suspended, rightly, it did create a bit of a headache for the universities, and a lot of thinking and out of the box thinking, or out of the ear thinking, had to take place, because from a university perspective and from a workforce perspective, you know, it is important to make sure that we still have people coming into the workforce. So a lot of thinking went around this in terms of helping students. So the students who are graduating, one of the things that the RCCP is doing is asking students, or supporting them, to create a Cpd portfolio. And one of the things we'd like them to do in one of their first activities is to consider how COVID has changed their profession, because they're in a very interesting transition period, going from being a student, being on placement, and supposedly going into a job that they've been doing placements for over the 3 or 2 years of their course. And now it's a very different situation. So the portfolio is just to help them to reflect on that, and it is another measure to provide them support, to think around, you know, what they need to maybe get a bit more practice on. So things like that. CPD is a very important part of any professional's career and development. So it is hoped that this will also just kickstart CPD, because we all know that there is an audit every 2 years. But more information can also be found on the link. And that's about it. That's it for me, Sue.
Thank you very much, Lizanne. Let me move that on to Kath.
Okay, thank you again. We've had a question from Tony. He's asked if he can update on what the BTA are doing for signposting. So shall we do that after this?
Yes, we can do.
Okay. So early on, after we shut down, of course, it was recognised by the NHS that, you know, because it was so sudden, there was going to be a lot of anxiety and a lot of stress around what we were trying to do. So they produced some good information, and I'm sure in your own trust, your health and well-being, departments have actually produced some things to help you to get along. But what we decided to do is to have a look at some of these to see what they did. And I took a look at NHS in Mind, and I also took a look at Headspace, so I'll cover those. So NHS in Mind was put together by some cognitive behavioural hypnotherapists and a mindfulness teacher, and it's all on YouTube. So we go to the next slide. So this is quite an easy one to do. I went through all this. There's 8 easy access short interventions, and they last from 1 minute to 21 minutes. So they can be done, say, in your break times, or at the end of the day, or even at the beginning of the day, because some of these are quite helpful for that. The idea is to help to alleviate and combat you know, any anxiety or fatigue, because let's face it, it is quite tiring being on online or on telephones all day. It isn't quite the same as being face to face with a lot of people. So the 8 ones, so there's box breathing. So that's a simple breathing exercise that just takes 2 minutes. The other one is notice 5 things, and that is a little bit of a mindfulness session, and that's about centering yourself and bringing your thoughts back together a little bit. That only takes 45 seconds. See, some of these are very short. Then you have 3-minute breathing space, and that is just about practicing some nice breathing techniques, and then some short meditations on the breath again. So a few of these are around some breathing exercises and some mindfulness. And those of us who are quite involved in tinnitus management and therapy will be very familiar with some of these tools that are produced here. So it's worth having a look at them. And as I say, easy to do, quite straightforward. I would definitely recommend this one. So go to the next slide. and I'll go through each of these. Okay, so on here I decided I would look at how long they did actually take. So you don't have to do them all. You can dip in and out of them, you know, whatever time you've got to do them. So, and even now, even though we're sort of at a slightly different place at the beginning, I still think there's a lot of anxiety around, and it's very useful to practice some of these techniques if you can do. So the next slide. Okay, so I look at Headspace, and I don't know if many of you have actually used this tool at all, but this is downloadable. It's free for 1 month. I just dismissed the advert that's on there. And it gives you notifications for practicing and doing some breathing exercises, doing some mindfulness, doing some actual physical exercises as well. So they look at different areas. So it might be, I mean, not everybody feels stressed or anxious, but you might have trouble sleeping. It might be that you want to get a little bit fitter. It's not been easy to get out and about in these days. So there's lots of different videos that sort of put together for these things. So you build up your tools as you want them to. So there's 9 videos on there, and they last from 4 to 20 minutes. There's 6 SOS 3-minute meditations, so these are very, very quick, short meditations that you can do. And then there's 8 single meditations that take between 3 and 10 minutes to do. And then there's 4 animations that are there to help encourage you, and they last about a minute. So all pretty quick to do. So it's you know, it's having, you don't feel you have time, there is time to do these sorts of things. So Headspace is very good. I know there's lots of others out there as well. So we go to the next one. Okay, so my recommendation would start with NHS in mind. It's free, it's easy to use, it's accessible at work and at home. If you need to do anything long term and access a large number of tools, then perhaps try Headspace, but only perhaps buy the full app if you feel it works after your free trial. And don't forget actually that, you know, a lot of the tinnitus apps out there are really good. They're free and they cover a lot of the same tools. So, you know, explore, and you know, it's okay to feel anxious, it's okay to feel stressed. We're only human and we're dealing with very difficult situations. So yeah, that's my little bit there. Can I hand now over to Sue?
Hi, me again. Hopefully you can hear me.
Yep.
Yep, cool. So one of the other things that we were very quickly asked to do by our heads of service was ideas for CPD and what people could do when they weren't doing clinics, how they could improve skill sets within their departments, and also for some of the staff that were unfortunately shielding and couldn't come into the department, just sharing ideas on CPD. And all of this we've put onto the BAA website for you. So the first thing is that for all our members, all of our conference presentations from last year are now available to you online. So if you are a BAA member, you have free access to all of that. In terms of the magazines for BAA, they're now also all online for review. So again, if there was an article that you've read and you've thrown away your magazines, although not many audiologists seem to throw anything away at all, then now they're online for you to go back and look at. But we also looked at online training things as well. So I think there were things like tinnitus modules, the IDA Institute training, all of those things were there for you. So we gave you all of that information, tried to group it for you as well. But then we needed some offline ideas, so if people couldn't access computers, if they weren't available to do that. So there was things around peer review processes, clinical competencies, all of the review and developing patient information, and we've talked a little bit about some of that might be helpful from the third sector, but also that whole raft of things that we shared, because there was a point where heads of service quite frankly needed you to let them get on with a few things and needed to be able to give people tasks to do, just to kind of make sure that the department was going to be functional again when we were all ready to get back up and running. So lots of you are still working on this, lots of you are still developing materials, and I am going to signpost quietly to BTA as well. I know Crystal said RNID, Action on Hearing Loss, have a Tinnitus Helpline, but British Tinnitus Association have done a CPD event for you each month, which is an online journal club. They're great because they're upping your skills in tinnitus, but they're also a really social thing where you can actually see other people online. They're evenings, and you can review a particular paper with the group. The next one is Veronica Kennedy in a week or so. I'm going to get told off because I can't remember the date exactly. It's in my diary. What we have in terms of BTA is their helpline still working, so they've all moved out of their office. They're all working virtually, but their helpline is there. They've had an increase in the number of calls, but if you do have somebody who is struggling with their tinnitus, then please send them there. And don't forget, we got the BTA BAA module up and running as well as part of your CPD. So that module is there, and it's an assess module on our website as well for your CPD, and you can have an e-certificate for completion of that after you've completed the learning piece, the reflective piece. I'm going to thank the people that are actually looking at those for us and passing and cooperating with people to get them passed on that module as well and offer support. So I'm back to Kath now with recovery plans.
Hi again. Okay, so obviously with the recovery plans, we're all now at that point where we're having to think about our services. I know there's been a few questions come up in the questions box as well about where we are up to, and I think that's quite interesting at the moment that NHS England have only produced the guidance for paediatric services, and we're still waiting for the guidance for adult services to come out. So some CCGs are not allowing people to restart routine yet until that guidance is out. So I'll just quickly update that there's been letters sent out to the Department of Health to try and push this forward. So we're just waiting now to see what's going to come back from that. However, some people have actually put some things together. So in the Isle of Man, so this is Stephen's. He's the head of service in the Isle of Man. He talked to us about what they've been doing. So they were able to start seeing routine patients a little earlier than we have because things started to get a little bit better in the Isle of Man. So in early March, they had to stop everything, of course, and they were in absolute lockdown. But then they started to plan their recovery and write out their standard operating procedures towards the end of May. And they were able to start to resume routine by mid-June. And then they're hoping, I mean, obviously they're not starting fully yet because of being able to see the right number of people, and that's where we're all going to be up to, of course. So we're just waiting to see when they can see a lot more people. So is in the Isle of Man, as the 15th of June, public social distancing was abolished, but it still remains in healthcare environments, and I think that's probably going to be the case for us. So no matter about what distances are going out in the general public, I think in healthcare we're still going to see that 2-meter distancing going out. So they were able to start because they had 28 days of no cases, okay, and no activities, and the borders were still closed. So go to the next slide, please. So he produced a standard operating procedure and he shared that with us. So that's on the website. You can have a look at that. That might be helpful. I think it's good to share what we're all doing, because why reinvent the wheel? You know that there's some good advice out there. He went off the guidance that we'd started to put together, and of course that's that is still being updated. He was reviewing things monthly as well. So some of their points were around the PPE, infection prevention procedures, the distancing and the screening, and what they looked at in terms of having to do face-to-face. So, and of course, we're all looking at this for our standard operating procedures about what's going to be important, what's urgent to see, and what we can do in a hybrid way, and that'll be a mix of virtual, telephone, and face-to-face. So their standard operating procedure is less restricted than that of the UK at the moment, because, of course, there is at a far further advanced stage than we are. However, there could be a second wave, and we have to be ready to prepare for that, so they can cancel that standard operating procedure with immediate effect. And I think that's something that we will all have to look at, that we have something for reopening some of our services, but also something in place, as we have done now, where we can go back to where we were at the beginning. Can we move on to the next slide, please? Okay, so for Stephen's terms, that the positives for him were that patients could be seen, and of course being able to see people face to face, even urgent, is quite good. Patient compliance was good, so they were happy with the PPEs. They didn't have any DNAs, which is fantastic. So there was a good uptake of doing some telephone and virtual. There's an opportunity for the permanent use of virtual methods. And I think that's where we're probably all going to be as well. I don't think virtual is going to go away. We're not going to stop this. It will be embedded in healthcare long term, and it's been talked about for such a long time, obviously, and that's where the SQC ManCAD came in to produce their information. There's new ways of working, and we're all up there, aren't we? We've had to really think very carefully about what we do and how we can do things in very different ways to make sure that we can still see our patients. So all his appointments have gone very well. There's been no breaches or untoward incidents. So some of the challenges, and we have these at the beginning, were the masks, of course. Obviously, being able to lip read and some steaming up. We've all had that, haven't we, with especially if you wear glasses, that they steam up. They've had a reduced capacity due to the environment, so that's going to affect their waiting list, and we'll all have that as well, of course. So this is looking at how many patients we can see safely in our environments now, and that's what we need to think about. We're not going to be able to see the same number of patients that we did before, so that is going to have a long-term impact, and that's where we need to have different ways of working. So there's a support group, and they still do some outreach. The outreach clinics that they had are still suspended, and I think in the UK as well that a lot of community places are still not open fully, and they're still obviously the implant and surgical referrals. That was a little bit of a challenge for them as well, but I think that's gradually coming back into place. We can move on to the next one, please. Okay, so other recovery plans that we're still working on pulling something together to help services. We've got lots of shared resources on the website, including some ideas of where we can go, and some services are changing in protocols and new ways of working. So let's share that. There's some good ideas there. So Debbie Rose from Pennine has uploaded hers. We've got some from the Royal Berkshire. And then we've got the project brief of the new telecare in audiology for BAA. So please go and have a look at those. Very useful resources for us all, as we're all starting now to think about our recovery plans. And if you've got things to share, please, please, please share with us. Okay. So on here, on the website, we've got project brief, we've got data protection impact assessment tools. As you can see, we've got something on the pediatric glue ear telephone fitting standard operation procedure. So the list of all these resources are excellent. And then people have been sharing some of their letters and the leaflets. So we've had to change the letters that we've had to do to inform patients about what it's going to be like if they do come in for face-to-face appointments, and also about the virtual clinics and what that's going to be like for them. So it's just letting them know that we are there for them, but we're working in a slightly different way. And I know that everybody's been doing a lot of postal repairs, batteries, and even fitting. So that's going to be interesting long term to look at how these are impacting on our patients. And the next one, please. Can I hand this back now to Sue, because this is her area?
So I got quite interested in what face masks are doing quite early on in this, in terms of our patient population. And there is a piece of research out there in the hearing review, and I've noticed that ReSound have also published some research this week as well that adds to this body of evidence about the issues that our patients particularly, but all of us, are going to have when we're talking to people with face masks on. And I'd urge you to go and look at the information there. The other thing we're going to have a lot of is lost hearing aids. Particularly, we found this particularly with the US restarting and being told that they do definitely need to wear face masks in a lot of states. We have had an increase in lost hearing instruments, and we're seeing it across the private sector in the UK as well. And of course, comfort with receiver in canal and BTE hearing aids as well. One tip I'll give you right from the start is that patients are better with a mask that ties or has elastic that goes round the head rather than round the ears, and they will definitely lose more masks, they'll definitely lose less hearing aids that way. So we were particularly worried when the government made an announcement that all NHS staff in England would be required to wear face masks at all times. Whether they were with patients or not was the agreement to start with. And there was a thing about if you're COVID secure, then you can take your face mask off. But it concerned us not just for our patients in audiology, although obviously we see a higher proportion of people with hearing loss, but we were much more concerned about our patients that were going into other departments where they were going to struggle. And the way the announcement was made made some trust to say that people had to wear them even if they were doing video consultations away from patients, they still had to wear a face mask. So we felt it was really important to mobilise and to mobilise quickly, and we wanted some information to go out around what we could do that was extra. We didn't want people to stop wearing face masks. BAA don't believe that the use of face masks is a problem. We believe that there are things we can do to mitigate, and the most important thing was we were very aware of a clear face mask conversation that was going on, that development work was going on, and that testing work was going on, and we wanted to make sure that remained high on the agenda for the health services. So we asked people to share information. So we wrote to MPs, we wrote to the Health Secretary, we wrote to NHS England CEO and asked them to share some information that is about, if you're wearing a mask, what else can you do, and about the problems with masking, and not the normal rule of masking, rule 3 of masking, which we all have problems with still. It was more about face masks at this point. So we did write to everybody that we could think of. We put lots of social media out. We asked our members to write as well. And we wanted to include something that was very, very simple, and that was this particular document. It was developed by an audiologist called Susan Griffiths, and I give her absolute credit for it. It's not an extensive list of the different apps that are available. It's just ones that we know are working and some very brief communication tips. We also wanted to talk to our heads of service about some of the things that we can do. So we were looking at setting a COVID memory. If you do see somebody or you are doing a remote programming, giving them an increase in their soft sound above 2 kilohertz, leaving the MPO where it is, trying to just improve their hearing if somebody is wearing a mask. Making sure we signpost and give out good communication tactics advice, and try and get that through our networks within our workplaces as well. Talking about remote microphone technology, because many people have purchased mini mics and similar devices, and just talking about that use of remote microphone technology with patients and family if they were struggling. And then drawing up a tips leaflet for things like live transcribe as well to include in your information packs. So those were some of the practical things we could do. We've got some results. So the NHS sent out the communications tips poster to all directors of nursing, medical directors, infection control leads, accountable officers and COVID leads. It certainly opened up some conversations for staff who have hearing loss, who were able to attend their audiology departments if they were struggling to communicate with people with masks on, get a check on their hearing aids, get a check on their hearing, get some advice from audiology. And that's worked quite well in a number of departments around the country. The question has been asked about clear face masks in open parliament, so to the Health Secretary, and has been responded to now. NHS supply chain have purchased 500,000 clear masks. They're arranging for them to be agreed in terms of what usage they can be used for, and they will be allowed to replace the fluid-resistant surgical mask. So that is an agreement that in outpatient clinics certainly will be able to use them instead of fluid-resistant surgical masks, which is great news. They are on their way into the country. There will be an initial allocation to every place, every location, and then they'll be on supply chain for you to continue to order. So you should be talking to your procurement departments about these already. But what's the really exciting bit is that we are also looking that the funded research at Cambridge, which has been done by their clinical engineering department, is centrally funded research on an FFP3 clear mask. So when we need that highest level of protection in critical care, there is an FFP3 mask that is now starting to get into test production and will be approved for use in critical care. And also that Cambridge have been allocated the resources because the fabric to make some of these things has been restricted by the government to certain organisations, and they have now got clearance to be able to purchase all the things that they need to start making masks in the UK as well that meet our standards too. So there were some really positive things, some really quick wins on this one. We don't believe that people should be taking masks off within 2 metres, and we've never said that. We believe masks are one of the ways that we get out of this pandemic. But we do believe that we should be promoting clear masks. So we've talked about what we've covered in the heads of service meetings, and we now want to just give you a brief update on some of the projects that have been ongoing in BAA. And the first one is our website. So hopefully some of you noticed that about 4 weeks into the pandemic, Victoria, our communications executive, was trying to update 2 websites at once. She was updating the old website and she was trying to launch the new one, but we did get the new website launched, and you will see some of those images are from the new website. So if you haven't been to visit recently, then please do visit. One of the greatest parts of this is the Knowledge Hub, and the Knowledge Hub is in the members area, and it will give you access to lots of information on different types of services, different podcasts, different videos are in there, trying to build your CPD, but also trying to become a resource hub as a go-to for our members. So if you want to learn a little more about tinnitus therapy, then there's somewhere you can go and you can find various parts of the learning around that. If you need the protocols for pediatric audiology that are agreed, then you can go into the Pediatric Knowledge Hub and you'll find those kind of pieces of information in there. The website is very much an ongoing and a developing process, and we are always looking for people that want to contribute, that want to do videos for there, but also that have great information to share with us. On the website, after every Heads of Service webinar and every webinar we've done, you've found pages that have been added with resources. This is where you'll find that huge amount of documentation Sam talked about in terms of your remote clinics, how you might start them, what you might need to consider. All those protocols that have been shared and developed are all in there. We try and cover as many of the frequently asked questions after webinars as we can as a document onto the website there as well. So as I said before, we have done a huge amount of work on the website. Very shortly, and this is actually in print now, so we'll be landing very soon, is the new BAA magazine. So it's a new look magazine, completely redesigned to make it more engaging, hopefully, with you and give you lots more information. We are looking for a new editor of the magazine within Pubs and Comms. So the editor that we've had for a number of years is Sarah Coulson, who has stepped down recently, and we will be looking for a new editor for the magazine, or a group of editors. We also did rebranding last year that may have kind of gone under the radar a little bit for members, but we do have these leaflets available to download. So if you are asked to send something out about what is audiology or contribute to a virtual careers fair, then all of these leaflets are available as download. We can provide small amounts of physical copy, but we tend to take those to events when BAA represent you. But we do have new branding on those and new information leaflets as well. We have set up a mentor scheme within BAA, and we have had a number of people volunteer to be mentors. We'll be contacting them just to get a few more bits of information, and we will set up some online training and support for the mentors. And then, of course, the mentees who are looking to match with mentors that suit them in terms of where they are in their careers, around transitions in careers, new skills, new job opportunities, things like that. So we are going for all of those. We relaunched the higher training scheme, and the higher training scheme was relaunched last year at conference, and this is building on skills that audiologists already have to train them to a higher level. It's open to all members who are working at level 5 or above, and it's in-service training plus the M-level study module. We are going to do a webinar on career development on the 22nd of July, and the HTS will be covered in detail there. These are the modules that we have available at the moment, and you can see that some of them have changed. Many of them have already been revamped, and some of them are already being revamped, just because these things need to move on and evolve as our practice does.
Okay, yeah.
Barbara, we can hear you. Just to say that regional meetings have restarted online. So we've had a recent regional meeting for Thames Valley, which went really well. We had about 100 people online with us. And with the regional...
I'll double check if she's an inpatient at the moment, but as I was here...
Yeah, with the regional meetings, when you log into the website now, you will see the regional meetings are for your region. We're hoping to get more of our regional volunteers running meetings again, and that should be happening over the next few months, so you'll start to see those again. We trained all of our regional representatives on IDA person-centered care, and we trained them to be trainers. So you will see them. You will see them talking a lot about our IDA person-centered care partnership, and hopefully they'll be adding some of that into their online regional meetings. We did have an IDA seminar booked on Pediatrics. We have closed the booking on this because there is no information that would suggest that we would be able to run a large meeting in September. So we are going to move it to February 2021. If you've already got a booking on this particular day, then you will get an email to confirm whether you want to book onto the new date as we announce it. So
she's not patient at the moment. She was added to...
We are struggling. to mute Barbara, and I apologise, everybody. She's on her phone, and it is difficult to move to mute phone calls in. What happened to conference? Well, we were all excited, all ready to move on to conference, and we obviously had the problem that our conference venue became a Nightingale hospital, and looked like this for a time. Although the conference venue is mothballed, there may be some option to run something this year in a conference venue, although, as I say, we're not utterly convinced. The thing that worried us most was that the availability of staff to get out. So we were quite concerned that most people wouldn't be allowed study leave for the conference, because we were going to have waiting list pressures when our waiting lists are released. So although it is a COVID Nightingale hospital at the moment, we were hopeful it would become a conference centre again, but we have had to unfortunately postpone this year's conference and move online. So really excitingly, this is the first of our virtual learning resource, BAA Online. We felt, again, because of the study leave issue, that we wouldn't be able to deal with a conference that ran over 2 days or even 1 day, because people wouldn't be allowed out for that length of time. So we have decided to run our conference over the next 5 months, right up until conference starts. On conference week, we'll do a webinar every day, but during this period of time between now and when conference should have been, we will try and put 2 webinars on a month, and our list of dates are available there on the right hand side, but they're also on the website. And we're going to try and theme each month. So we're going to try and put 2 webinars on as a minimum each month, and to theme those webinars. So you'll see those themes coming up here. Excitingly, you can get involved, so you can still submit abstracts, and we will run virtual posters, but we will also look at some of the abstracts to present. Again, it will be webinars, but we will look at trying to pull some of the best of those abstracts, best of those discussions out for people to take part in webinars and to run their own webinars, just as we would have given you 3 paper slots at a face-to-face conference. And we haven't got rid of awards. We believe awards this year are probably more important than ever, and the award nominations are now open on our website, all being managed a little bit differently this year, but you'll find all the details of how you can nominate one of your colleagues or your team for an award on the BAA website now. So we're getting towards the end of this webinar, and I just wanted to say that board are all volunteers. We all have day jobs, we all have other things that we have to give precedence to sometimes, but we're all really committed to try and support you. But the more people we get involved, the more support we can give and the more things we can actually do. So at the moment, we will have 7 spaces on board in November. Thankfully, quite a few of those are board members who are coming to the end of their first term and are very happy to stand again, but we will definitely have 3 spaces that don't have somebody standing again, but also, of course, this is a member vote, so you could decide that you want different board members, and the thing to do now is to look for those nominations for board, which will come out in August, and put yourself forward to join us. We are looking for as many people as we can. We have a limit on the number of board members, but only in terms of an agreed limit in terms of money and finances of getting to meetings. So as I say, at the moment, we're looking at 7 spaces being available on board in November. Goes out to a member vote, but of course we need people to stand and think, yes, I can do that. Yes, I could have helped them at this point and I should get more involved. So I'm making a plea that we really do need people to stand. If you don't think you're ready for board yet, you're welcome to have a conversation with any of us. But if you don't feel that, you might want to join a team or a committee. And that's certainly where we found a lot of our board members. They were lurking on our teams and committees, and we've talked to them and mentored them into joining us on board. So at the moment, we still need more people for publicity and communications. As I say, particularly, we have lost our magazine editor, our early professionals group. So any early professionals out there, we want to kickstart some work around our early professionals. I've already mentioned about being a mentor, and of course we have our separate HCS examiners group as well, all volunteers. Next webinar, Wednesday the 22nd of July. This is going to be an overview of career development really, so different things available from BAA, but also the national programmes that you can perhaps use to develop your career as well. Bookings for that webinar are now open, but we would just like to run a very quick poll with you to see what time of day works for webinars for you. We talked at the Heads of Service meeting about this, and they gave us the answer that the webinar works in the morning and quite early in the morning, but we thought we'd ask our wider membership. So you should be able to see the poll now, and you can vote on what time of day you would prefer our webinars in the wonderful world of webinars to be. So I'll just give you a moment or two to look at that. So things we're hoping to have on the career development webinar are things like our higher training scheme updates, talking a little bit about the mentorship programme. We're hoping to have people who've taken part in some of the NHS leadership development programmes. We may persuade somebody who's doing the HSST to give us a little bit of time from their busy schedules to come and talk to us about the benefits of HSST and where they've been. So all of those things there. I'm not able to see how many people have voted, so I'm just waiting for Victoria to do that and close the poll. Hopefully you can all vote on the iPad. It's a little bit different, but you should be able to find it on there. Okay, poll is closed. And you should be able to see the poll results there. They're very, very small on my screen. Early morning still seems to be coming out as best, even with this group of people, so that's great. So we probably will run the career development one at 9 AM, and Victoria's going to shout at me any second now and say, we didn't say that, but anyway. Just wanted to say that we are around, we are available as board. We try and respond to everything that you send us. It's not always easy, but we do try and get back to you. We have our able admin team at Fitwise, so I just wanted you to see some faces from Fitwise, because I know that some of you do communicate to Kendall about your membership and to May about general BAA matters. They answer the admin at BAA Audiology email, and that's always the best place to send an email, and it will get distributed out to the board member that needs it. But of course you can also contact us through any of our social media, so Facebook, Twitter, LinkedIn, and even Instagram. For those of you that are about 20 years younger than me, you'll understand more about Instagram than I do. But we do try regularly to get this information out. Couple of points to note: if you can't make a live webinar, they will be available in the members area as recordings, so you will see lots of video recordings there as well. And also on this webinar we've had some handouts for you, so things like the Isle of Man recovery plan, the joint guidance, I can't remember the other thing Victoria told me to mention, but all of those things have been available to you as downloads, so they are there for you. So thank you for joining us this morning. The remote working documents is the other big one to mention for you that were there as downloads from this webinar. Thank you for joining us this morning. We hope you found it informative. We hope that we've covered most of the things that we've been talking about in Heads of Service meetings for a wider audience. And we look forward to seeing some of you on the 22nd. And if not that one, then lots of other webinars over the next few months. Keep safe, everybody. Wash your hands.